Symptoms of urinary tract infection or UTI, burning, urgency, and increased frequency of urination can be signs of various STDs in males and females. The three UTI symptoms are burning on urination, increased urgency, and high frequency of urination. Out of three UTI symptoms, the most reliable one is burning with urination. The most reliable means doctor trusts the most as a sign of infection. The reason for that discomfort is when urethra is infected and inflamed and it hurts when the urine touches it during urination. The burning can be at the tip of the urethra, along the urethra, or in the bladder area, lower abdominal region. The STDs most commonly associated with UTI symptoms are Chlamydia, Gonorrhea, Trichomoniasis, Mycoplasma, and Ureaplasma. Because males and females' genital anatomy differs, the significance of UTI symptoms as STD sign is different for both genders. Therefore, we will discuss the two groups, males and females, separately. My name is Slava Fuzayloff, and I'm a practicing STD physician at STDcenterNY, located in Midtown Manhattan, New York City. I know you have limited time and I value your time. Let's proceed. Let's talk about males first. If you're a young sexually active male, has a urinary symptoms of urgency, increased frequency, and especially burning on urination, it is an STD unless proven otherwise. Why? Two reasons. Males have longer urethra and prostate fluid has antibacterial properties. Unlike females, the underlying reasons should be investigated and explained if males have frequent bladder infection or so-called UTIs. Urologists do it. So what STD tests need to be done in males with UTI symptoms? The most common STDs that need to be ruled out are Chlamydia and Gonorrhea. If Chlamydia and Gonorrhea tests are negative, other non-common STDs and non-STDs need to be considered as a second step, such as Mycoplasma, Trichomoniasis, Ureaplasma, UTI, and prostatitis. The next thing I need to mention is how those tests are done. They can be done either via urine or penile swab tests. The urine test should be first catch urine. It means that the urine can be collected at any time of day if more than 20 minutes pass since the last urination. The first catch urine test is equivalent to urethral swab detecting STD infection. The treatment while we wait for the test results can also be considered. It's usually 100 milligram tablets of doxycycline taken twice daily for 7 days. Further treatment can be given after the results are back. Now, let's talk about how we approach females with UTI symptoms. Before proceeding to this portion, I would like to take a moment to ask you for a favor. Support our channel by liking this video and subscribe to our channel. Let's go back to our topic of STD testing and treatment for females with UTI symptoms. The approach to UTI symptoms in females differs since bladder infection or actual UTI is more common in females. Can it be an STD? Yes. However, STD are not at the top of the list for UTI symptoms in females. Why? Females have different anatomy, such as shorter urethra. And at the same time, sexual activity moves bacteria from rectal and vaginal area to the urethra causing UTIs. So what tests are done in females with UTI symptoms? Since UTIs are common for females, we do the rapid dipstick in the office, and the general urinalysis test is sent to the lab for more accurate results. If there is a high suspicion of STD, the STD tests are done. The suspicion for STD is higher if it was a new partner, one-night stand, sex with multiple partners, or unprotected receiving oral or genital sex. The following tests can be done on the urine specimen as a first step: Chlamydia, Gonorrhea, Trichomoniasis, and Mycoplasma. A Ureaplasma test is done if the other tests are negative. All tests mentioned can be done via urine using the same urine sample. If STD is suspected, the vaginal swab should be considered as well for the same conditions. Urine collection techniques are different for STDs and UTI. For UTI, clean catch urine is requested. That is, urine should be collected into the cup midstream. For STDs, first catch urine is requested. That is, very first urine should be collected in a cup. As far as the preliminary treatment is concerned, most females are treated for UTI initially. Why UTI? Because it's statistically more common in females. STD preliminary treatment is given for females when partner calls with an STD or when suspicion of STD is very high. The preliminary treatment can be given for chlamydia and gonorrhea. That brings us to the end of the video. If you learned something and it was helpful, please remember to give this video the thumbs up and subscribe to the channel. And if you want to share your experience in the comment section to help others, please do so. Thanks for watching, and until next time.